Hello dear viewers, I'm Dr. Olena Berezovska. I would like to share the latest data on benign tumors of the uterus with you. If you are interested in this topic, please watch a video. Fibroids are benign tumors of the uterine muscle wall or smooth muscle myometrium. Another name is myomas or leiomyomas. The fibroids found in 40% of women aged over 35 years. At the age of 50 years, uterine tumors are found in almost 70% of Caucasian women. Leiomyosarcoma is a rare malignant tumor of the uterus that occurs in 1.3% of all malignant tumors of the uterus. There is another type of uterine smooth muscle tumor of unknown malignant potential. This type of tumor is dangerous because it is almost impossible to predict the outcome of the disease, but it is difficult to diagnose this type of tumor without surgery. The causes of myomas are known, but if they appear at a younger age, like 20-30 years, they are often hereditary. Two genes, HMGIC and HMGIY, are involved in the development of leiomyomas. Pregnancy often causes an increase in the number and size of nodes, which particularly regresses after childbirth. Fibroids can differ dramatically from each other in their microscopic structures, presence of necrosis, atypical cells, and other features. Three types of myomas are typical, mitotically active, and cellular leiomyomas may resemble a malignant process but are benign. The number of progesterone receptors and their distribution pattern are prognostic markers for determining the type of leiomyoma. Most malignant tumors of the uterine smooth muscle do not express progesterone receptors. In modern medicine, there is no diagnosis of uterine fibrosis, and the size of the uterus is not comparable with that of pregnancy. Fibroids are always nodes, the size of which is determined using ultrasound. Depending on the location of the nodes in relation to the uterine wall, the types of fibroids are as follows: subserous nodes under the uterine capsule, intramural interstitial nodes intramuscular, submucosas under the endometrium inside of the uterine cavity. Subserous nodes grow into the abdominal cavity and can grow to larger sizes. They can be accompanied by the pain and disruption of the functioning of the neighboring organs. Intramural nodes are more common than others and can cause intermenstrual or menstrual bleeding, pain during periods, and on any day of the cycle. Submucosal nodes are often accompanied by bleeding of varying intensity and or pain in the lower abdomen. However, they can cause complications during pregnancy. In most women, uterine fibroids are not accompanied by symptoms and do not affect body function. Therefore, no treatment is required. The treatment of fibroids should be individualized and based on the symptoms, size, and growth rate of the tumor, location of the nodes, the woman's desire to become pregnant, and other factors. If there are no complaints and the size of the nodes is less than 5-6 centimeters, observation is required. Usually, with the onset of menopause, nodes begin to shrink in size. Symptomatic treatment, elimination of complaints, it's painkillers, hemostatic drugs, and anti-anemic drugs. The effectiveness of these treatments usually decreases over time. Medical treatment is a conservative treatment when first they try to reduce bleeding and slow down the growth of nodes. There are no medications in medicine that can stop growth of fibroids completely or even lead to their disappearance. Hormonal contraceptives do not reduce the size of fibroids but improve the regularity of menstrual cycles while reducing the duration of bleeding and the amount of blood lost. The use of progesterone and progestins to treat fibroids is controversial because in some cases progestins slow down the growth of nodes and in others they accelerate it. Rapid node growth often occurs after hormonal treatment is discontinued. However, progestins can reduce the intensity of menstruation and blood loss. Therefore, women with fibroids can use them for this reason. The intrauterine hormonal system with levonorgestrel has been proven to reduce menstrual blood loss in small submucosal intramural nodes, but it does not reduce the size of the nodes. The effect of progesterone and progestins on fibroids in women are individual and unpredictable. Gonadotropin-releasing hormones agonists can reduce the size of fibroids by half during 3 months of therapy. Danazol, synthetic androgen, reduces the size of fibroids by up to 25%. These drugs should not be used by women planning a pregnancy. Previously, they were used in the preoperative preparation of women when laparoscopic or hysteroscopic removal of the nodes was planned. However, current data suggests that such preparation worsens prognosis, so most doctors have abandoned it. Other drugs that can directly affect node tissue are being studied, but so far they are all undergoing clinical trials. Radical treatment involves the removal of nodes, organ-preserving surgery, or the uterus, which is now most often performed using laparoscopy and hysteroscopy. Organ-preserving operations include the following: uterine artery embolization, laparoscopic uterine artery ligation, laparoscopic radiofrequency ablation, cryoablation, high-intensity focused ultrasound, abdominal myomectomy, laparoscopic myomectomy, hysteroscopic myomectomy, and hysteroscopic radiofrequency ablation. None of these operations are 100% effective and require repeated interventions after a certain period. Recently, there has been much speculation regarding the effects of certain types of food on the growth or regression of fibroids. The following diets and foods did not affect node growth: whole foods, meat, alcohol, coffee. Insignificant risk of fibroids growth is found for fats, fish, dairy products, some vegetables. A reduced risk is observed when consuming fruits and vegetables. Data on soybeans are controversial, as according to one study the effect is not proven, according to others the risk increases. We'll talk about this more in other videos. If you like the video, do not forget press like and subscribe to the video channel. Please provide your comments and see you soon.